Hi everyone, I'm Dr. Wallemeyer at the Advanced Podiatry and Neuropathy Center in Fort Myers, Florida. Wanted to talk a little bit about ingrown toenails today, why we get them, what we can do to treat them, what we can do to prevent them, and just some little tips and tricks that I've picked up along the years to help people deal with these things. So first of all, why do we get an ingrown toenail? This usually happens because there's something that's applying pressure to the side of the nail where the skin is. We call that the nail fold, and that nail fold gets a little bit swollen. And when it does that, then the nail starts to grow into that skin, and that can create a break in the skin, potentially infection, certainly pain. And then that area just gets more swollen and more ingrown, and the process continues until we do something to remove that toenail. Other reasons that it might happen would be you try to cut the toenail back a little bit too far when you're trimming it, or maybe you get a pedicure and the pedicurist tries to quote unquote dig them out. That's a really bad idea. The most important thing is don't try to remove these things at home, okay? Because if you do, you're more than likely going to create an infection on your own. I have a lot of people who maybe get one on the weekend and there's no podiatrist open, so they go to the urgent care or the ER to try to treat an infected ingrown toenail. And unfortunately, they won't do that. The only thing they'll do is give you antibiotics and tell you to follow up with a podiatrist. Um, you need really to see a podiatrist anyway for this procedure because it's something we do all the time. First of all, I do two or three of these a day. We have the right tools, we have the right equipment, and we're the best trained doctor to take these out. It's very quick and simple. We generally numb your toe where it attaches to the foot. So we're not sticking needles into the area that hurts. We numb it back behind that area. And once that toe is completely numb, it only takes a few minutes to get it completely out. We just cut out the side that's ingrown, a few millimeters only of the nail plate. And once we've cut it all the way back under the skin, then we can grab that and we can pull it out. And this is like hitting a reset button on that ingrown toenail. It's going to go away very quickly. You'll see almost immediate relief of your symptoms. Actually, we can take it out permanently if this is a problem that is recurring, keeps coming back, or it has just been there for a very long time and you're sick of it and don't want to deal with it. Occasionally, once we remove that part of the toenail and we let it grow back out, it will get re-ingrown again because it's just this little flat part of the toenail that's growing out different than the rest of your toenail. And if that happens, we can remove it permanently. I happen to use a laser to cauterize the nail root where it grows from. Most podiatrists use chemicals to treat that, and they create a little chemical burn, which prevents that part of the nail from growing permanently. Um, I do my best to make these look as cosmetically appealing as possible. We don't want to take out a huge chunk of toenail and leave you with a little sliver on the top of your toe, especially if we're doing it permanently. Um, so these procedures take about 4 to 5 days to heal. All you have to do is apply some Neosporin and a Band-Aid. Certainly don't want you going in the Gulf of Mexico or anything like that right after this is done. But you can get in your pool and you can be in clean water, take normal showers, things like that. Um, the most important take-home points for this are you really need to get treated right away. Don't let this get infected because it's much more difficult to treat at that point. It's a lot more painful and it becomes a lot more urgent of a problem. So now let's talk a little bit about prevention. What you want to do is when you're cutting your toenails, make sure you cut them straight across. Don't try to dig down into the corner of the skin and all that kind of stuff and cut it really short. What you're most likely going to do is not be able to get all the way in there, and you're going to break off a little piece of that nail and leave a spike, and that spike is going to grow into your skin and cause an infection. Um, Tip number two, don't let a pedicurist dig them out. Any digging into that nail fold, anything that where you're trying to get out that corner, you're never going to be effective because it goes way too deep for you to get it out on your own without any numbing medicine. If you are getting a little bit of pain at the corner of that toenail, best thing to do is soften it up. Use some creams, lotions, Neosporin, something like that with a Band-Aid over it, and try to soften up that nail corner. Put some ice on it. Try to get the swelling down. And if you can accomplish that, a lot of times you can get this to go away on its own. Most important thing, get help if you're having a problem. Don't put it off. Make sure you get treated as soon as possible. If you're having a problem like this and you'd like to get it taken care of, we'd be happy to help you. You can call our office at 239-204-5602, or you can book online at our website at fortmyersankleandfoot.com. Thanks very much. Have a great day.